huge challenges in being able to access many healthcare products, vaccines, therapeutics, diagnostics being one part of them, but many other essential medicines as well. At the same time, I think we often do not celebrate the successes, and by successes I mean despite a large-scale supply chain disruptions globally, essential medicines were still in stock, not necessarily any more disruptions than what are routine, and many studies that have been done have shown that things have worked well. So we also ought to recognize that governments and their private partners such as pharmaceutical companies, logistics companies have played a role in continuing access to health products during the last 2.5 years. We want to focus this morning's discussion on thinking about where have we started to identify solutions that require larger scale deployment, solutions that truly demonstrate the value of public and private actors coming together to solve healthcare supply chain issues with the patient at the center, thinking from the bottom up and asking, how do we ensure that everyone who needs access is getting access? So that's our theme. We are going to go to each of our panelists for about 5-7 minutes for each of them to share their key insights. Then we'll have time for questions from you all in the audience, and then we'll go back to our panelists with those responses. So that's the structure. So if you have questions, comments, please reserve them. I'm going to introduce our panelists at the start, and then I will pose the questions to them. So I'll start with Dr. Ahmed. Well, Dr. Ahmed is the director of the Africa CDC, a recognized scientist in the area of public health, has done a lot of work, and you all may have seen his work and his previous roles, so I won't necessarily go into bios, but thank you, and we are glad to have Dr. Ahmed with us this morning. Next, we have Christina Storer. She's the Vice President for Policy and Government Affairs at UPS for India, Middle East, and Africa. UPS has done a lot of work in healthcare supply chain, some of which Christina will share with us. Next to Christina is Joe Terrence. Joe is the Senior Director for Global Public Health Supply Chains at Johnson & Johnson Janssen Pharmaceuticals. They do a lot of work in supporting public health supply chain infrastructure and capacity development, which we'll talk about. Next to Joe is Bronwyn Tim. Bronwyn is the Director for Strategy and Partnerships at the Africa Resource Center based in South Africa. They do a lot of work on partnerships between government and private actors, which she'll tell about. And last but not the least, Skopena from the Afrexim Bank. And they have done a lot of interesting things in the last 2 years, which he'll tell you about. But not only in the last 2 years, they have been an active player in the healthcare sector over a long period of time. So he'll share some of that with us. So with that great panel, I want to start by asking Dr. Ahmed. Last 2 years, Dr. Ahmed, lots of discussion around access to health products, vaccines, therapeutic, diagnostics in particular. These are not the only products that the health sector needs, but that's where a lot of the focus of attention has been. Where do you see, have we been able to identify where the core challenges lie, and how do you foresee the path forward? What structural, bigger ticket changes are we thinking about making, which can bring government and private actors together?
Thank you for that very broad question in 5 minutes. we will try. Let me start by the hidden fact of cold chain as a profession. We don't see it as a profession many times. And therein lies the reduction in its visibility. And because of that reduction in visibility, we've seen a lot of challenges, and I'll share only 3 during this pandemic. The first is getting the cold chain equipment itself. Has been a huge headache on the continent. In fact, today as we speak, we still don't have what we had asked for about a year ago, because it's not stuff you put on the shelf. Many times after it's been bought up, it has to be manufactured afresh. So one is just the access. Second, for us in Africa, is the appropriateness of what is accessible. if I want the cold chain to reach a village right out in the rural areas where there is no electricity, it's totally different than when I want a cold chain equipment in the city, because power is going to be an issue. So the appropriateness of the equipment itself has been a very big challenge for us on the continent. And this will be the kind of power it uses, the size it is, how easy it is to move from one place to another, etc., etc. The third thing is use of the cold chain equipment. Do you have individuals who can be able to use it appropriately so that it lasts for long and it can serve the purpose for which it has been bought? So these are the three big things. Actually having access to the cold chain equipment themselves, the appropriate type, and then those who can be able to use it efficiently when it goes down to the community level where you need it. In between the challenges of from one, let's say, equipment to the next. If we have a very big storage facility at the airport and you have this small facility at the village level, how do you connect from the airport all the way to the village level? That mechanism has been a very big headache and still is for us in Africa. But going forward, the opportunities that are there are huge in this space. And the two that I see are very key is, one, we need access to cold chain equipment on the continent. We don't want to be importing it from XYZ places. And when, as we've experienced, trouble comes with an outbreak or an epidemic, and God forbid a pandemic, borders are closed, markets, export markets are closed. We want the manufacturing on the continent. So whoever takes advantage of setting up facilities that will manufacture appropriate cold chain equipment is ahead of the game. And the second is the training of appropriate professionals who can not only manufacture but also look after the equipment. Because these are not things that you buy and tomorrow you need another one. You want to keep it for a long time. So who's going to look after it? Servicing, repairs, training. So these are two very key things that whoever takes advantage of them is going to be really serving not just the continent well, but also making a big contribution to health security, not just on the continent, but globally. But for me, it is an area that we've ignored as a profession, and we need to grow it and make it a fully fledged profession in our health security, planning, strategizing, and response. Thank you.
Wonderful. So cold chain, both manufacturing, installation, maintenance, but perhaps also the transport, like you said, from the large capacity cold storage rooms onto the ones at the site. A recognition that that's an area we've not paid enough attention to, and we will. That brings me to Christina. UPS has been doing a lot of work, not just in Africa, but globally, in both international and national leg transport and storage of COVID vaccines, but also for healthcare products more broadly. So tell us more about the kinds of programs that UPS has run, especially in regard to COVID vaccine and COVID technology deployment.
Absolutely. Thank you so much for having me. At UPS, our purpose is moving the world forward by delivering what matters. And what matters to us the most is to deliver hope and help to those in need. So we have been out front delivering critical medical equipment, PPEs, testing kits to all those health workers and essential workers since the start of the pandemic. When it comes to COVID-19 vaccines, we are delivering what matters to where it matters most. And we are super proud that as of today, we have been delivering more than 1.5 billion COVID vaccines globally. When it comes to the UPS Foundation's vision, the UPS Foundation is leading our global citizenship efforts and philanthropy. It is creating an equitable and just world. And while COVID-19 impacted us all personally, it did not impact equally everyone around the world. So we saw we have to step up. as we believe that we have the ability, but as well we have the responsibility to accelerate and facilitate the transportation and delivery of COVID-19 vaccines. So our UPSers around the world have been incredible, busy delivering those vaccines for the last almost 2 years to all the people in need where it really is required. And so far, we as well as the UPS Foundation, we have been donating more than 39.1 million vaccines, the delivery of those vaccines, and 25 million of those actually have been delivered to the African continent. So by providing transport solutions, that's one part of the entire work we are doing. It's not enough. So what we said, we have to do more in order to really provide that capacity building and as well the access to these different medical equipment. So really providing support, overcoming these logistical challenges, and especially where there's as well a lot of infrastructural challenges around the world. So when it comes to that work, partnership matter a lot to us. We couldn't have done any of those by ourselves. We have been partnering with our friends in the audience, Pfizer. We have been working with UNICEF, UNHCR, with CARE, with Zipline, with Swoop Aero. And together we have been delivering COVID-19 vaccines across 18 countries and 5 continents. Coming to your question when it comes to the partnerships we have and what we're doing, especially here on the continent, I would like to highlight 2 extremely exciting partnerships. One of them is with Gavi, the Vaccine Alliance, and with Zipline. I don't know if you know, but since 2016, we actually have been working together, and we have been establishing the world's first drone network delivering critical medical equipment and medicines. So in 2016, we kicked off in Rwanda, where we started off with delivering blood, which is completely necessary when it comes to reaching people in rural areas which perhaps had a car accident or gave birth and have heavy bleeding. So we saved millions of lives. Then we went in 2018 to Ghana for the second drone expansion, again with our partners Zipline and the Vaccine Alliance, Gavi. And I'm super proud to say that just last month we launched our next expansion in Nigeria, and we're going to launch in Kenya shortly. And why those matter, it is because we're not only delivering COVID-19 vaccines, but as well we are delivering blood, medical products, and those are saving millions of lives. And the second partnership I'd like to highlight is with Village Reach, an NGO, and Swoop Aero, which is as well a drone technology company out of Australia. And we partnered in Malawi. And together we're working on ways on how we can get vaccines faster and further out in Malawi to reach really people in areas which would not get access to those medicines otherwise. And what's pretty cool on that, I don't know if you have an idea about, reaching areas in Malawi when it comes to rural areas really requiring those vaccines, knowing that less than 20% on the continent are fully vaccinated. But it can take up to 6 to 7 hours. And through the drone technology, they're cutting down the time of transit of those vaccines to 15 to 20 minutes. So this really helps us saving a lot of lives and get access to basic health care and equitable vaccines way faster.
So it seems like international transport, storage, drone transport, you have a lot of things going on. They seem to be working. So what are the challenges? Are there challenges you face in your work?
Of course there are, and I think Dr. Ahmed already touched on many of those. So when it comes to these hurdles we are seeing, it's all the way from vaccine hesitancy to vaccine transportation, vaccine storage, cold chain, all the way to last mile delivery, as you mentioned as well. So for us, there's actually 3 simple things which we think makes vaccine delivery successful. First of all is the technology. Thirdly, it's the storage. Secondly is the storage, and thirdly is the know-how, the experience. So when it comes to the technology, I was just talking about 2 examples highlighting our drone networks across Africa to get vaccines faster and further to people in need. But as well, delivering equitable basic health care means that as you mentioned earlier, we need this cold chain and storages in areas where perhaps we don't have access otherwise. So what we have been doing at the UPS Foundation, we have been donating more than 250 ultra-cold freezers, as well portable cold chain carriers. We have been building delivery sites out of nowhere from scratch in different countries, and we have been doing that with many of our partners. When it comes to storage, these vaccine carriers enable that these vaccines are safely stored and then as well can be transported to the final destination. And then lastly, when it comes to the knowledge and know-how, it's really bringing our own experts, our own UPSers, our heroes and sheroes, which are trained for humanitarian efforts to countries in need. And one of my colleagues, actually, Basi Anari, is with me today in the audience. So when it comes to the program called UPSers Experts on a Mission, we are sending people to countries such as Ethiopia, Kenya, Cameroon, Ghana, Malawi, and so on. And we're providing training on the ground for ministerial workers, any of those local partners, as well to facilities and healthcare facilities. And we train them how to facilitate cold chain. We work as well with Pfizer on specific cold chain management trainings. We as well train them how to bring that vaccine to the last mile. That's very challenging. So that's really a goal for us, to really teach the people on the ground. So when the UPS is not on the ground anymore, they can still manage. And I think the beauty on that, these three items I just managed, storage, technology, and know-how, everything is not just related to COVID-19 vaccines. Actually, what we're doing can be used for medical medicines, it could be used for blood and anything else going forward, such as childhood vaccines, knowing that last year 25 million children actually had no access to their necessary vaccines.
Thanks, Christina. We'll get into some more of these as we talk more to our fellow panelists, but also when we answer audience questions, because I think embedded within that are questions in terms of, okay, so if all this is available, what are the platforms to access that and so on. Joe, your turns from J&J. So your global pharmaceutical company has an important role to play in the healthcare supply chain. Tell us more. Firstly, as you think about serving countries in Africa, what key challenges do you foresee relative to other markets, and how are you contributing to solving some of those challenges, both yourself in partnership and other ways?
Thank you for that question, Prashant. And thank you for having us on the panel here, because we're delighted to be here and very happy to be here at the conference, because we think it's a fantastic event. We've learned a lot, and it's so good to have all these open conversations. I'm going home inspired, energized, but with a lot of ideas and contacts to follow up. So congratulations to the CCA. And then to your question, in J&J, we're deeply committed to the health of people in Africa, and part of that is strengthening the health system, including the supply chains that keep the health systems up and running. And we have a team in the J&J focused on people in low and middle income countries. It's our global public health team. And we actually have a lab to last mile approach. So we do research on the continent for diseases that specifically affect the continent. But we take it all the way through to capacity building and then to delivering. And so that's where supply chain comes in, and to understand what we need to do to deliver our portfolio of the innovative drugs. We did some deep dives in the countries, because we were delivering HIV medication, we're delivering TB medication, we're now working or launching a new Ebola drug, obviously the COVID, but we're working on new diseases like dengue, old diseases like leprosy and so on. And so when we did those deep dives, so three key challenges. We already heard about a cold chain, and it's really a key challenge. But then other challenges that we saw were that frontline healthcare workers, I think we all know, they're very thinly stretched. And on top of that, they're tasked with supply chain tasks, but many of them even don't realize that the reporting that they're doing, that it's actually informing the supply chain. So many of them aren't aware of that, so they have to put those consumption and demand data in, but they never get much back from that system. And if they really don't know, what it's serving, that it's it's often that the quality of that work is not ideal. So the data in the system are often fragmented because also the supply chains are fragmented. So there is some significant challenges on that end. Next to the cold chain challenges, where we went to 1,500 facilities in different countries to really understand the problem. And as Dr. Ahmed said, it's equipment, but it's also maintenance, it's repair, it's the frequency of the shipments that come into the cold chain. It's many aspects, and then you have the power supply, as was mentioned, and so on. And then next to that, we also see that to tackle those challenges, it's not an easy task. So you need leaders that are heading up the supply chains that are really thinking transformational, because to bring about the change is not incremental change, it's transformational change. And we see that the people that need to do that are often not equipped. They don't get the opportunities to become those transformational leaders. We met many people that wanted to visit with us in Europe or in the US, but they never actually visit with their neighbors, because you have so many good practices, so many good things happening on this continent where you could learn from each other. And so that's where we try to step in on the leadership, for instance, and we're opening our own leadership development programs in J&J. We brought in some leaders from the continent to sit with our leaders that are being developed to take back from our programs what can be improved. And so we're working in partnership with PTD, with ARC on that, and also on the program that UPS started in the past on STEP. And we really want to bring in more scale there. So we committed to 50 leaders a year that would support that. Next to that, we're working with your own organization, INSEAD, and Empower. We sponsored that to set up a community of practice for the supply chain leaders so they can get together, learn from each other, but also learn best practices that are out there in industry. So we think that is very important. But also for the frontline healthcare workers, we're designing a curriculum to help them understand their role in supply chain and how, because they're committed emotionally to the patients, that's where they want to spend their time. So it's normal that they spend less time on doing the reporting if they don't understand how it's going to serve their patients better. So we're designing that curriculum. And then also on the cold chain, we're designing a curriculum because we see that there is a big need, as Dr. Ahmed mentioned, for training. And we want to support that because there is training needed for the many different stakeholders in the cold chain. For instance, the people that are buying the equipment, sometimes they're buying the cheapest equipment, not thinking about what equipment is needed where in the supply chain, not thinking about the maintenance and repair. And you can't blame them for that if you're not being trained on that. So it's just a few aspects of what we're doing. But also on the cold chain, we can't do it alone. Just like Christina was mentioning, it takes partnerships, it takes people working together. So we're trying to build out a coalition on the cold chain where we can have more people join us to do the research, and we're willing to share the research that we're doing, but especially to focus on capability building. And then we're working with the ARC on planning tools, on forecasting tools, but I'm going to let Bronwyn talk about that.
Excellent. Thanks, Yo. So, Bronwyn, we heard from Yo that a global pharmaceutical company is keen to partner, is already doing some partnerships, not just around supplying their own products, but trying to build capabilities. We heard from a logistics company how they are bringing their expertise to the fore. What does it mean to bring these actors together? You, at the Africa Resource Center, you call yourself as the enablement, connection, collaboration platform. So how does all that happen? And in your response, also tell us not just global companies such as UPS and Johnson & Johnson, but like Dr. Ahmed pointed out, I mean, there are also many companies on the continent, both manufacturers of health technologies and equipment, but also logistics companies, new young innovators who are creating new companies to solve healthcare supply chain challenges. So how do they all come together, and how does ARC facilitate that?
Thank you very much, Prashant. And just like Yo said, thank you to Corporate Council on Africa for inviting us. It has been an amazing summit so far, and we have got a lot of business cards to follow up on next week. So as my fellow panelists have said, the focus of Africa Resource Center is on health system strengthening, not individual programs, not individual types of supply chains, whether it's cold supply chains or ambient supply chains. Our focus is to look at the capability and the sustainability of the Ministry of Health colleagues that we work with in 10 countries actually. So I'm based in South Africa, but we've got countries in West Africa, East Africa and Southern Africa. And as I said, there are 2 pillars around how we build sustainable and capable supply chains within our Ministry of Health stakeholders. The first one is to look at how do you build the ownership and the governance within a Ministry of Health around their supply chain. The second one is to bring in the partnerships that we've spoken about now, but we've got other partners involved as well, is to say how do you reimagine your supply chains, bringing in private sector engagement and innovation. So I'll give examples of both of those, and they're both necessary but not sufficient without each other. So when you talk about ownership and accountability by the Ministries of Health, it's helping to build a capability, like my fellow panelists have said, so that they understand around building supply chain strategies that are costed through budgets or investment cases, that then have roadmaps to implement it, and probably most importantly, there are governance frameworks around them to say, are all of the players aligned and coordinated and following the supply chain roadmap? So that's on the one side around the ownership and accountability by the Ministries of Health. On the reimagining supply chains, or bringing in private sector engagement, this is where we work at both a global and a local level. So some of the innovations that we bring in from a private sector perspective is to say, what does a J&J do in planning? How do they build their centralized planning systems and tools and processes? And then how do we help translate that into the public sector? Because what is described and understood and potentially even seen as base level in private sector may be groundbreaking in the public sector, and often not understood the way it is meant to be. So outsourcing is another one. So how does outsourcing happen that you still have control over your supply chain, even though you've outsourced it to other providers? Some of the other places that and a really exciting one that if you'd been in the roundtable yesterday that I spoke about was differentiated channel distribution, and I'll talk more about the Uganda example later. So Yo mentioned that we've worked closely with J&J for 5 years actually across all of the 10 countries that we've been in. And I mentioned the example of centralized planning and using a tool such as Anaplan. We're agnostic of the tool, but it's using a tool to demonstrate how you can take the function of centralized planning and translate it into an environment that the public sector can use. So we started that in South Africa, but we're looking to roll it out in Namibia and in Senegal and across the other 8 countries that we're in. The other exciting work that we've done, not just with J&J and UPS, but the rest of our private sector advisory board, was to build an outsourcing toolkit. And again, that's translating private sector best practice from investment cases around why would you outsource, through to how do you put an RFP in place? What is an RFP? Then how do you put good contracts in place? Contracts that have the right incentives, contracts that are understood and bought into by both parties, and then how do you actually implement that? And we've used a lot of learnings in South Africa, for example, around warehousing and how did J&J outsource their warehousing, and what learnings, both good and bad, did they have? And then, as I said, the exciting one that we've worked with our mainly our fast-moving consumer goods partners is the idea of route to market or differentiated channel distribution, which is how do you get your medication to patients at the last mile, but in a way that's patient-centric. So it's a very fast-moving consumer goods model around saying, where are your patients? How do you get the medication to them in such a way that it makes it easier for them to to take and adhere to their medication. So in Uganda, we've worked, this is to Prashant's question around local and global, we've taken a global concept of differentiated channel distribution and route to market, and we've applied it and adapted it to what is happening already on the ground in Uganda. So there were already models coming out of the IDI, which is an academic institution, and other community healthcare models, and brought best practices to say, how do you take chronic, stable patients out of public healthcare facilities that are congested, long queues, overworked nurses and healthcare workers, and how do you take them into other channels, such as the private sector pharmacy model, which is what IDI has done, and then that's mainly in the urban area, which is only 20% of the population in Uganda. But then the community healthcare worker model is to take, again, chronic stable patients out of healthcare facilities and into community-based models, so that it's better for the patient. In COVID times, the fewer people who actually came to the healthcare facilities, the better it is for the overall health of the population. But as I was saying yesterday, the exciting thing there is we started with HIV, with the AIDS control program in Uganda, but we were actually able to start advocating for, if you can get HIV meds in the private sector, why can't you get non-communicable disease medication? Why can't you get other types of HIV, or TB or malaria or any other medication within your packet of medication, which takes away stigma and it takes away a whole number of extra trips. So that's the DCD example. I'm just looking at time. I think I told you about the two pillars, so ownership and governance by the Ministries of Health, bringing in private sector, translating it, helping to understand how you use innovations and best practice in private sector to reimagine supply chains. But the third leg, and something that is as important, and I think something that Kwabena will also speak to, is funding and financial resources. So currently the way that funds usually flow in the public sector is through donors or through government financing. And our goal as Africa Resource Centre, as a long-term institution on the continent, is to say, how do we change how funds are deployed so that they think about systems as opposed to programs, and then also where they are deployed in the actual country. So for example, in Uganda, we're working with the USAID mission there to change the way that their funds are deployed in that country. And I think to end off my piece of an example in Mozambique of both the partnership and the funding challenges, we worked with the UPS Foundation, with Work for Mothers, with the Global Financing Facility from the World Bank. Our partner in Mozambique is the Central Medical Store, CMAM, and then Gates also had the Gates Foundation had a funding element into this partnership. And with all of these partners, we built a 10-year investment case that took the capex costs of their warehouses and their distribution network from down to $60 million from $200 million. And reduce the OPEX costs by $6 million, which is a 30% decrease per year. Sounds great. We've got buy-in from Ministries of Health. We've got best practice from the private sector. The investment case is stuck. The funding to the government for both the refurbishment and the building of the 35 sites of the warehouses is not happening, and therefore the use of the improved OPEX and distribution network that we helped develop is not going to go ahead. So outsourcing to 3PLs and 4PLs in Mozambique has not started because we can't get that investment case funded. Over to you, Prashant.
Thanks, Bronwyn. A lot seems to be happening, a lot of partnership models that are either evolving or some are maturing. I think one thing we recognize is that for the healthcare supply chain to function, money has to flow, without which all of the ideas about bringing best practices, better information flow fall apart. So we'll go to Kwabena. Kwabena Ayiribi is the Director of Banking Operations at Afrexim Bank. Kwabena, what do you do? I mean, we've heard about your work with the AVAT, front-loaded financing, and the African Medical Supplies platform. So tell us more, both about some of the work in working capital financing in the healthcare supply chain, but also longer-standing work that has come out of Afrexim Bank in the health sector.
Yeah, thank you. And it's a pleasure to join these experts on the panel. But I think for us at Afrexim Bank, the last 2 years have been quite a rapid learning experience. Typically as bankers, we give the money. We don't really live the experiences of where the money goes to. But I think in this pandemic, we've actually had to live it. One of the practical experiences was the first ever shipment of vaccines, when we had to move 1 million doses of J&J vaccines from South Africa to multiple countries across the continent. And then we realized how interesting the whole healthcare supply chain system is. Ended up with combinations of private jet charters, people carrying them in cool boxes, etc. And then when we got to the point of actually scaling up to the program of delivering about 30% of Africa's vaccine needs, we in Afrexim Bank, unapologetically, we want to be Afrocentric. So the first thing we always look for is African solutions. And it was quite a challenge trying to find an African partner to be able to support the scale of what we wanted to do. And even more interesting was the fact that trying to do so out of a hub in Africa was impossible. So for us, I think this then introduces certain interesting things to look at, particularly as we move into an era where we are pushing for vaccine manufacturing on the continent. We are a trade finance bank, so naturally we think about how trade happens. It needs to move from place to place. And hence we tend to finance the construction of ports, roads, etc. But I think in this new paradigm, we have to work very closely with the experts in the industry to understand how we will bring that into reality. We do finance the health sector. We're currently championing the development of medical centers of excellence across the continent. But we believe that for this whole push for vaccine manufacturing to be on the continent, we have to work very closely to understand the different elements of how we bring the logistics into reality. Interesting to hear from Dr. Ahmed. We've been talking of vaccine manufacturing, but the note I've got now is the need for cold chain manufacturing. So maybe those are the things that we look to make available. The other learning point for us was the fact that the entire industry seems to be donor funded. That was a bit of a surprise, right? Because in our view, maybe that's not been the experience, but are all these funding streams perpetual, right? How do you transition some of these health models into a way where it is accessing capital in the normal form, not just donor funds, but actually commercial lending? It might be too expensive to move immediately from donor funding into a commercial lending structure, but potentially a blended approach where donor funds come in to actually offset the cost. And not directly there, but if you look at the partnership we have with, say, the MasterCard Foundation for vaccine procurement on the continent, whilst the entire AVAT program was intended to be commercial, but MasterCard Foundation committed significant resources which effectively brought the blended cost of acquiring vaccines to quite a manageable level. So I think the critical thing is understanding what the needs are, because from our side we can develop and adapt solutions very quickly to meet the needs. It is to see whether institutions like us can also work closely with the donor community to structure ways in which a more sustainable financing model can be developed for the continent, where it is not entirely dependent on the dictates of the donors. The donors would have their own objectives, right? But if they work closely with African institutions, then potentially we can bring and develop sustainable financing models for the sector.
Wonderful. Thank you, Pabena. I hope you realize that by mentioning this, your email inbox is getting flooded very soon with people who are distributors, manufacturers, who are all going to say, we're looking for trade financing, we're looking for supply chain working capital finance, we're looking for CapEx. So hope you're ready for it. But it is exciting to hear that there are many options, new windows are opening. And I think I do want to highlight that while we oftentimes think that a large part of the health sector and the healthcare supply chain expenditure is donor funded, that is not true. I think we see more of that as visible. If you think about where the real money flows start and end, I think it is people, patients paying out of pocket. It is government budget, which sometimes is a larger portion in many countries. So I think that is a significant portion. We ought to recognize that. Okay, we have time for one or two audience questions. So if you have a question, please raise your hand. And if you have a microphone, then use a microphone. Yes.
Thank you, Mr. Moderator. I would like to appreciate and express my deepest gratitude to the distinguished panelists for the excellent presentation. My name is Esaias Gota. I'm Ambassador of Ethiopia to the Kingdom of Morocco. The topic that we had just covered or are covering is a really topical one, a timely one, and we really, speaking about the COVID pandemic, we had gone through it. It is fresh still in our memory, and we are not yet done with it. But I just want to say, I mean, the insights we have, the distinguished panelists shared with us have been still helpful, and the efforts they have been making to help Africa and humanity to pass through successfully this pandemic is really indeed commendable. And again, my appreciations to you all for the wonderful job you have done to the humanity. And keep it up, keep it up. I just wanted to add that during the pandemic era, at the height of the pandemic, the Ethiopian Airlines, the largest airlines in Africa, has done a wonderful job by distributing over, I was looking at I was Googling and I just saw the data that over 50 million doses of vaccines were transported by the Ethiopian Airlines to more than 28 countries around the world and to much of Africa. So I just wanted to note that, this contribution as well. Thank you, Mr. Moderator. Again, thank you all.
Yeah, thank you. And before we go to the next question, I want to recognize that Ethiopian Airlines or regional airlines, not only for COVID vaccines, but even before vaccines were developed, when we needed medicines to be distributed, when there were supply chain disruptions, many belly cargo disruptions happened that couldn't bring supplies in. Ethiopian was running special planes, so I think that's a very well recognized contribution of a regional airline. We have a question at the back.
Thank you very much for the presentation today. A question, my company is called IFRIA, Cold Chain Development Company. We're investing in cold chain assets in North and West Africa. A lot of conversation around vaccines, which of course is very important for health supply chains, but one of many, many product categories for health supply chains. I'm very interested in hearing a point of view on storage solutions, certified storage solutions to support notably the pharmaceutical manufacturing industry, which of course is emerging in Africa, because there's a lot more volume, a lot more certified requirements around the manufacturing by many order of magnitudes larger than vaccines. But my concern in the public dialogue is that we hear only about vaccines, which of course is very important, but understanding the totality of those supply chains, including raw materials, including packaging, including picking services for distributing out to the pharmacies, really is underdeveloped in these markets and needs a lot more support and a lot more public focus?
Thank you for that question. Shall we start with Dr. Ahmed, since you brought up the question of local manufacturing cold chain, and then we'll go to other panelists.
No, thank you, and thanks for the comment and the question. Let me start with the comment and say, when we talk about the supply chain, and I'm stepping back from cold chain, when we talk about the supply chain for health products, so many gaps in knowledge exist, and we need to fill that gap and ensure that from airlines to the worker who will carry it on their back to ensure it reaches the health facility, that whole chain needs to be covered, recognized, and strengthened so that it can be able to deliver as efficiently as possible. To the question, the gap is so big when it comes to not just storage, because storage will follow either manufacturing or use. If you don't have manufacturing on the continent, then you can't store the raw materials, because then you don't need to store the raw materials on the continent. If you have manufacturing happening, then the solutions for storage, and we are talking about all health products here, not just vaccines. Vaccines are just nice to talk about now because we are talking about COVID, but really the real question is all the health products, from simple things like masks to the very complicated things like mRNA vaccines. So when you talk about the supply chain, we need manufacturing here so that we can improve the other aspects of storage. Second is you need a mechanism that delivers the products to the end user, because that too is going to ensure that we have storage facilities, however small or however big, to be able to accommodate that whole supply chain. So for me, where to start is to ensure that we can be able to get the product to the public, and second, we need to get manufacturing happening here on the continent of Africa. Then the supply chain will be able to follow appropriately. Thank you.
Thanks. We'll go to Yo, and meanwhile, while Yo is responding, I wanted to ask the other panelists. I think one other way I would like to add to this question that was posed is not just from the standpoint of cold chain, but for the healthcare supply chain more broadly, questions around the ecosystem, right? What parts in the ecosystem require more sustained investment, either public or private? But Yo, on the cold chain question.
Yeah, thank you for that comment in the first place, and you're absolutely right, 100%. It's exactly what we also saw when we did our deep dives on the cold chain, that it's much, much more than just the vaccines. You have products out there like the diagnostics in ARV, but so many diagnostics, but also oxytocin, insulin, you name it, from snake antidotes and so on. So there is a big need out there. But there is also indeed an opportunity to transform the thinking from the traditional thinking of cold chain being in health facilities to think about, can there be like a business model transformation? Can people make a living doing cold chain and doing appropriate cold chain? And can they have an area, for instance, that is focused on medicines, another area that is focused on fish and flowers and whatever supplies? Is there a way to switch over so that this can become a profession and that it can be really done in a much better way? So there is a lot of opportunity there and certainly need, and we would love to collaborate with all the different stakeholders on that, you know, just with the public sector ministries of health, but with companies like yourself, companies like ours, logistics suppliers. And so that's why we're thinking about this coalition to look at how can we together tackle this problem, get more research done so that we understand the problem, and then collaborate on bringing about transformation, because it needs transformation, transformational thinking. But again, thank you for that comment.
Any other panelists wanted to respond to this or a wider question around this? Christina?
I mean, I would just, I agree, and I would just add again, I mean, it's great from us as well to provide those ultra cold chain freezers, but if there's not the knowledge, the know-how, if we don't actually deliver what our experts in humanitarian work are doing to the local population, then we will never get those vaccines to the last mile. So, yeah.
Kwabena?
Yeah, thinking about that holistic ecosystem, One of the things that we are promoting is the development of farmer parks, right? We believe that it's not just potentially about setting up just a manufacturing facility. There are related industries, and I believe the logistics, storage, and others are all related. So we believe that if you co-locate all of these in a single geographic area, you optimize efficiencies, you reduce costs for all the different players in there. So that's one thing that we are looking at to develop with different countries. So for example, if Senegal is developing manufacturing, is there the appetite to expand it beyond that to the concept of a farmer park? And could we then bring in the cold chain storage players, other logistics within that ecosystem? That then makes it easier for us to do that. And I think it's just important we think about that as we push manufacturing on the continent. Thank you.
Wonderful, thanks. Bronwyn?
I had an interesting thought based on what Yo said around cold chain shouldn't just be about medication, it could also be about fruit or flowers as a business model. One of the ways that you can think differently in an ecosystem around maintenance is don't go to the traditional providers of maintenance, but rather look to how other companies maintain their fridges. So, for example, Coca-Cola has an excellent fridge maintenance capability that is outsourced. They're in their countries, or each of the bottlers have got relationships with excellent fridge maintenance suppliers. So how can we take those relationships, the negotiating power of Coca-Cola, and apply it to fridge maintenance within ministries of health, so that it's not just a capability that's for cold chain fridges, but it's an overall capability across all cold fridge maintenance.
Thanks, Bronwyn. Dr. Ahmed, you had a comment?
Yes, I wanted to add the angle of let's not think about supply chain in terms of complex equipment and machinery. We have a lot of traditional knowledge that keeps that kept a lot of trade and goods relatively fresh, coming from one source to the other. So let's not see only ultra cold chain equipment when we're talking about the supply chain. The communities have knowledge, indigenous, that are very useful to exploit, expand, so that materials can be able to reach where they actually need to reach. Now, who is going to study that knowledge and convert it into something that can be used within the health sector? This is a big gap, and we are all coming with a lot of equipment and demanding a lot of energy, which is not there. And yet there's a lot that communities here in Africa especially, the methods they used to use before, how do we make those efficient, available, and optimal for the health sector? Thank you.
That's fantastic. In my work as a professor, I think one of the things we keep reminding ourselves is it's not just about that know-how sits in global companies and that needs to be diffused to countries in Africa. There is a lot of very interesting and innovative ways that people have figured out, whether it is in the flower cold chain business, whether it is in ag tech, locally, regionally, and we also will learn immensely about how to do that if we create a bi-directional know-how flow, not just global know-how coming. So I think that's what we endeavor to do. One quick question I had for you, Dr. Ahmed, is you talked about cold chain, and much of the discussion tends to get indexed towards vaccines, but we also know that for a preparedness agenda, we need to make sure we have, we have genomic sequencing samples, we have to create a better surveillance architecture, we have to be able to bring samples from labs, take reagents to them. So there's also a supply chain that needs to keep operating to make sure that we can detect disease early, we get the reagents and the assays and all these things that are required by the lab. How does that work progress, and what is the Africa CDC doing about that?
Thank you for that. In fact, one of the hidden challenges we faced during this pandemic is how to get samples to a lab that will sequence them, how to get reagents for sequencing from outside of the continent to the continent so that our sequencing could be able to continue. It's challenges we face until today. But to the specific question, we need to develop three broad things to ensure that particularly the diagnostics part is well secured. One is and we have now a network of laboratories across the continent, get those laboratories to start thinking about what they can be able to manufacture themselves. Because everything begins in the lab. And if we get them the capacity they need, a lot of the reagents they can be able to do on their own, and we don't have to wait until it comes from out. So that network needs to start thinking along those lines, and we're encouraging them to do that. Second is governments need to walk into this space a lot more firmly, because the private sector will come, but as you are pointing out, the vast majority of investment in the health sector does not come from the private sector. So governments need to bring in that confidence that this area needs to be invested in, whether it is R&D or whether it is a supply chain. And then the third is we need institutions to begin pulling their weights more. As Africa CDC, we are doing our part, but what is each and every other institution that contributes to this doing? They need to reflect on that and pull their weight so that it is not only felt at their level, but it is also felt at the continental and global level. A lot needs to be done by different actors, but they're not doing enough. They're really sticking to the safe areas. But now it is time to step out into the new environment that has been created by the pandemic, and we do what we need to do as each and every institution pulling our weight. Thanks.
Okay, so we have about just over 3 minutes remaining. Here is what I want to do. I want to go to each of our panelists, and this time we'll start with Kwabena, and give them about 30 to 45 seconds to say, you heard some of the solutions, you heard some of the challenges, not just at this panel, but throughout the 4 days of the CCA event. If you have to make a few asks, one ask, two asks, to say, here are things that you want policymakers, funders, or other actors to do, what would those be to make sure that the healthcare supply chain is robust, effective, serves the patients, equity is maintained, and so on?
So I will have just one ask, and that is, ask us, right? Financing has been a key theme throughout a lot of discussions. It's not that there is excess funding on the continent, but there are pools of funds, and there are institutions that are willing to partner to actually deliver the outcomes that we are all looking for. So please do talk to us. If we can't provide you a solution, maybe we do know somebody who can provide you a solution. Thanks.
So the IT department of Afreximbank needs to be alerted that his inbox is definitely now getting flooded. Okay, Ronman, your take.
I feel like you stole my ask. I'll put it a bit differently then. As I said earlier, we need to think about how we change where healthcare funding is deployed, especially in the supply chain, but then also that's at a global level, but then also locally, how is that funding deployed, and the mix of bankable financing, donor financing, government financing, so that institutions such as the Africa CDC or Afreximbank or ARC, for an example, are able to strengthen health systems.
Yo.
Yeah, thank you. My one ask would be, let's collaborate, let's continue to collaborate, but also put it on steroids. You know, it's fantastic what we can do together if we all come from our own strengths, and I think many people are willing to do that, but so let's by all means collaborate, and as private sector we have something to contribute, we have our unique strengths, but we can't do it alone. And I think if we then also think on the long term, there is so much we can do together, but we really can have tremendous impact and drive tremendous outcomes. And I believe that, that is a big opportunity we have ahead of us.
Excellent. Christina?
I can't agree more. I think collaboration and partnerships are key, and that's what we learned today and throughout the last 2 days. It can be as simple as working what we did in Malawi with the local leaders of one of the states where we faced huge hesitancy of vaccines. Just really helping them to publicize the first vaccine shots helped us really to get more demand on vaccinations. I believe there are 3 things corporations and stakeholders can step up to. First of all, financing those healthcare systems. Secondly, providing the essential medical equipment and the technology. And then thirdly, providing expertise and know-how. While we at UPS are doing all of those 3, I understand not everyone can do that. And there's not one solution which solves all these supply chain challenges across Africa. But my ask would be that stakeholders think about where is their expertise and how can they leverage their expertise, partner up with other organizations, private sector and public sector, and deliver what matters and provide those equitable vaccine deliveries to people in need. As for us, we definitely continue working closely with our partners to deliver what matters and to ensure that there is equitable vaccine delivery across the world and that we continue saving lives.
Thank you, Christina. Dr. Ahmed.
Then it leaves me to say, come and physically invest in Africa. Don't manufacture and send it to the continent. Come and manufacture here in Africa. Afreximbank will get you the money. Africa CDC will give you the technical know-how, and the private sector will most probably give you advice as well on how it works. Come and physically manufacture in Africa.
Thank you. And I want to, well, I'm going to take 30 seconds to say I also have my ask, which is all of you are here and the panelists. I think we hear about need for collaboration. Dr. Ahmed is talking about, come and manufacture or be more present rather than, sending supplies. One of the key things that emerges is that, like some of the questions that were posed, there are local companies, there are regional companies, there are young business model innovators who have created new solutions. They don't always find a blueprint for collaboration. They don't know how to connect with Africa CDC, how to connect with UPS, with Johnson & Johnson, Afreximbank now, but hopefully they can connect better given that Kwabena has opened up his email address. So I think we also need to recognize that there needs to be not only a framework for collaboration that exists in global institutions or larger regional institutions. Some of that collaboration needs to happen with a very local blueprint. In a country, they can work with their Ministry of Health, with their local public health surveillance agency or their government agency. And that, the creation of that local blueprint of collaboration is then something that can feed into the global or the regional footprints. So that's an ask that I make, which is think about local actors and create some structures for collaboration. With that, I want to end this wonderful panel. I hope you took away some interesting ideas. I hope you have something from this that you can act on. But the panelists are here. If you have other questions, other things you want to bring up, once again, join me in thanking our panelists for sharing their insights with us. And thank you to CCA for organizing this.